The voice of the Blue Eagle, Radyo Katipunan 87.9.
Radyo, 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 Katipunan, radyo, Katipunan, radyo, Katipunan, radyo, 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 Katipunan, radyo, Katipunan. The voice of the Blue Eagle, kami di mapipigil sa pagbabalitang tumpak at tama. Buhay atenista, sa loob sa labas ng eskwela, ating ibibida lahat ng eskwela. Radyo, 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 Katipunan, radyo, 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 Katipunan, radyo, Katipunan, radyo, Katipunan. Kawal ni Ignacio, Katipunero sugo, todo sa kayod, tulong at tulong. Lipad na Blue Eagle, galing hiding at tigil, blue and white, one big fight. Radyo, 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 Katipunan, radyo, 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 Katipunan, radyo, Katipunan, radyo, Katipunan, radyo, Katipunan.
All right, good afternoon. It's Jovi Miroy on Thursdays on our Science, Technology, and Society program called RK Asks. All right. This afternoon we have an exciting topic to talk about, especially since we have one of my favorite students as a panelist. But before that, we see him already there. Before that, we'll have our regular COVID update from Doc Butch Ong and Dr. Ben Vallejo. Butch and Ben, you want to say hi to our viewers?
Hello, everybody. Welcome again to our show. And tama-tama, Jovi, I have an Okta report, which is quite fresh from the press.
You're on the news lately, no? I wasn't able to follow it though. I'm not one who will fan controversy. What was the reason? You didn't want to advise getting out of the quarantine. What was the?
Yeah. I'm on the news a lot lately, almost every day. No. It's mostly advocating for the slow opening of our industries. Advocating for the study of the sectors like transportation sector, the BPO sector, and the manufacturing sector as they open their industries slowly. Well, of course, the hospitality sector, which is the hotels and resorts, So as they open their industries slowly, we should also study the nuances of those industries, So. Precautions in the technology or BPO sector is different from the precautions in the hospitality or the transportation sector. So
all right,
that's what I've been doing lately. So I've been doing the media rounds lately.
All right, but before that, let's ask Ben to say hi to our viewers.
Hello, thank you again. I was out of commission. No, I was quite busy in the past few weeks, so I'm not able to be part of the program. No.
Apparently, the Baywalk,
Yeah,
the
that's
Baywalk controversy is still ongoing.
It's still ongoing, no. But well, since we started about COVID, so what am I doing with respect to COVID, no? First of all, we are looking at the data from a certain government agency on how the nature of COVID transmission is happening in one government agency. No? Interestingly, there are very interesting angles for future research in that. No, then also yeah, another important issue is, and I probably could tell listeners, no, UP will decide on how it will admit its next intake of freshman students, no, because with the COVID pandemic, it will be quite hard to have the UPCAT exam, okay? In the way that it used to be, no. So what are the possible options? First is online, but of course we have major infrastructure and connectivity issues. Or we can have limited test taking, which means yung UPCAT testing centers will have a reduced number of test takers, but again that has some risk. So all of these options will have to be fully studied before the university and the Board of Regents will
Of
decide.
course, Ateneo has decided to forgo the asset.
Wala na kayo
So,
asset, ha?
walang asset, walang entrance test for this year. But we'll continue with that topic. Let's have Justin say hi to our viewers.
Hi, good afternoon. I'm so happy
Hi,
to be
nice
here.
seeing you again.
Yeah. So, who's listening to us? Ateneo and UP and
Yes,
everyone
and,
along the trip.
Yeah, so on Facebook, the alumni will be accessing it when they can.
Oh,
Facebook
I'm
and,
so happy to be here.
All right, so we have a lot to talk about in relation to psychology, psychiatry later. But first, let's have the COVID update from Dr. Butch.
Okay, so as I share my screen, hold on. All right, there it is. So I hope you can see it. Okay, so this is actually as of October 19. I'd like to remind everyone that this is from the Okta research team. We are an independent research group, right? And we provide our updates and our recommendations on a regular basis, no, at the very least twice a month. So this is the latest one, which was released about 2 days ago. By the way, Dr. Ben Vallejo and I are members of the UP or the Okta research team. So as of October 19, this is our latest report. We have 359,000 cases, and we are expecting around 390 to 410,000 by the end of the month. It really depends on how we navigate through the pandemic, no? How well we are disciplined enough to maintain our minimal health standards. No? So our active cases is 42,200, and the recovered cases is 310,000. We have a death rate for COVID of around 2%. No? It is not so high, but just remember, no, if you are part of that 2%, that's devastating for the family. No? So I'd like to remind everyone to still practice the minimum health standards, no? Even though the death rate is quite low. No? So we have held on to the reproduction number for the last month of less than 1. This is extremely good news.
That's 1 month na.
Yes, around 1 month. Actually, beyond 1 month, about 1 month and 1 week. Now we have held it to an R value of below 1. So now it is at 0.8. No, for the whole country. The Philippines, which is the epicenter of the pandemic, has the R value of 0.7, and our positivity rate is going down. Remember, last week I reported the positivity rate at 8%. Now it is at 7%. It is going down. The WHO ideal positivity rate is at 5% or lower. No, so
5%.
5%. So we
So
are.
do you think we will reach that? We're at 8, no? We're 8.
We are at 7. We are at 7.
7. So do you think we'll reach the 5?
We will, but the positivity rate is inching quite slowly every week. It's almost 1% every 2 to 3 weeks. No, so we are inching our way down to the ideal. No? But for this report, I'm going to give you guys something special naman. No? Kasi I've been talking about the whole Philippines and NCR, but we have in our report specific provinces with a high number of new cases per day. No, this is from October 12 to 18. No, and this is the snapshot of parang hotspots in our country. NCR, of course, is number one because we are the epicenter, no? And we have the most number of new cases, around 810. But the greater Manila area, GMA, Cavite, Rizal, Laguna, Batangas, and Bulacan, no? The greater Manila area, are still a little bit high. No, the ones in red indicates increases in new cases. So Rizal, Quezon, this is a province, Zamboanga and Negros Occidental have a little slight increase in the number of new cases. The ones in blue decrease. So good news for us, NCR, and most of the Greater Manila area, pababa na yung ating, we are going down in the number of new cases. No? So congratulations. No? However, look at this. Look at this. No? So the top 11 upwards. No? Pampanga, Benguet, Baguio, no? Pangasinan, Davao, Cebu, Misamis. They're all red. Up to Nueva Ecija, they're all red. No? So, but very few numbers on 60 new cases, 30 new cases, 22 new cases.
So what's the rate of increase in these provinces?
We reported that in attack rate, which I will show you later. No, now we are showing these numbers, although they're very small. No, 60 new cases per day, so that the local governments can prepare early. No, can institute early policies, no, to avert the sudden surge. No? So, although remember the R value for the whole Philippines is still below 1, we're just saying that these provinces might want to look at their monitoring, their contact tracing, their testing, right, and their hospital capacities. No?
Who is telling them that?
Well,
who is really encouraging them to be on top of the?
In Octa, we're doing this by if they want to have more data, they can simply request from us. No? But through these reports that we give almost every week, no, they can access it by just emailing us. No? So this is the attack rate.
So that's still based on, the decrease is because of face mask or wearing face mask or...
Yes, we have not changed our strategies with the minimal health standards. Although the WHO, I think the CDC had an update on the mode of transmission. So the CDC updated that aerosol transmission could be a possibility, no? But we have not, in general, we have not changed our strategies. No? Now, in this slide here, I just want to show you briefly the attack rate is the cases per day in the population of that LGU. No? So Quezon City has 5.6 attack rate, 5.6% attack rate. No? These are the NCR cities and municipalities. Now,
what's an attack rate?
Attack rate is the number of new cases per population. No, so this is over 1,000. No, so now I placed this here because remember several days ago there was talk of the Metro Manila mayors wanting to extend GCQ until I think December. I think the end of the year. Right, so they can have some of the data we have here, but as you can see the ones in red, so tumataas ang attack rate, or they are above. LGUs marked in red are above the 7%.
I see Makati there. Justin, are you still in Makati?
Right now, yeah, I am.
Now, Metro Manila or NCR is special because although it's made up of independent cities, no, it is interwoven, no. So people live in the residential areas are in Quezon City, Marikina, Pasig, and they work in Makati. They work in Pasay, no. So it is like an intricate web, no. So if one municipality or city has a high attack rate, no. The other cities in NCR might actually want to pay attention as well and institute programs for the mobility of the people. No, all right. So let me just
sure. Yep.
I just want to have one more slide. So from rank 11 to 20, as you can see, no, Well, Baguio City, it has been said that it has been reported that Baguio City is already opening up to tourists, no? And sorry. So here we have Mandaluyong and Marikina, as I mentioned a while ago, residential areas, no? Some residential areas like Marikina are still have a high attack rate. If I go back to Quezon City here, Quezon City status quo siya, no? Pero it's ranked number one. So the residential areas, no? Dr. Ben and I, before predicted that the transmission of COVID, no, will transfer from the workplace to the home. No, that was, we made that statement. I think in around June or July. No, so it seems to have held. No, kasi yung Quezon City, Pasig.
What accounts for that transfer?
Well, first it was in the workplace, no, and then we instituted strict lockdown. So, and they went to the communities. In the communities, the minimal health standards sometimes are not really followed. No, people don't wear masks. They visit one another in the neighborhood. No, they have parties. Remember, this was a time around June, July, and August, no, which we had a large spike in the number of cases, and the doctors and nurses asked for a timeout, no, and we see in media, in the news, that people were going to karaoke, they were having parties, right? In the streets, they were all out without wearing masks, no? So I think that accounted for the number or the increase in the number of cases in the residential areas in Metro Manila.
I see.
So I shall
So
stop.
that might be related to our topic today, huh?
Yes, yeah. With regards to mental
But
health,
yes. But Ben, do you have something to add, or do you have another update from your side? From the Manila Bay. Or you have another update?
Manila Bay is another issue, no? It's still there. Okay. One of the things is whether the improvements on the Baywalk can be sustained, no? So that's the main, but the scientific evidence would show na it will be hard for the government to sustain it. And the only way the government to sustain the improvements is to add more money and buy more sand. Okay, so that's the big thing, no? Yeah, but of course, how long are we going to be able to do this is another question, diba? That's for the well, the main issue last week was the uncalled for uncharitable statements against our research community, which our research community did not take very lightly. Okay, and
In the University of the Philippines.
no, it's not just UP, it's the whole science community. The whole science community, but of course UP is the one who first issued statements, no? Actually, a lot of universities issued statements. UST came out with the first. It's actually UST that came in with the first statement. And UST came out with a statement in Filipino, okay? Then later on, UP came out with a statement, and of course, that's what the media picked on.
Yes. But that seems to be like they were expecting you to support them. The discipline is the scientist is beholden not to the where the funding is coming from, right?
No, what the science would point out will be the responsibility, professional responsibility of the scientist to point that out, what the science would say, and where will it lead to in cases of.
But that is touching on science advice, no? To what extent should they adhere to the evidence?
The good thing about this is even our legal profession has already
There might be, because it's an environmental question as well.
Considered it. No, there's they're talking. The legal community and the science community are talking to each other about the
liability,
where the law can what the law can accommodate, and how the sciences could inform our legal system on how to deal with problems like this, because the what happened in Manila Bay is essentially it exploited one loophole in our environmental law. But of course, it's the lawyers that can act, would be in a better position to talk
At the
about.
very least, maybe there should be an
Yeah.
ombudsman.
Kasi the present environmental law has certain di ba, exceptions, no? And one of the exceptions is one of the I think it's Tony Lavinia. Tony Lavinia is the one who spoke about
who was
it.
with DNR, yeah.
Told us about it in a webinar. The Sigma Rho fraternity sponsored a series of webinars on this, and I was in the panel last time. No, one of the law would allow the government to put an exemption to a project, and if I remember right, this is one of the exemptions. No? And one thing is, if we're going to have be fair about it, perhaps we should close the loopholes or narrow the loopholes, no, so that there is enough oversight and accountability for
Yes.
projects like this.
Correct. Because he's with DNR, Antiporda.
Yeah, akala ko si Tony Lavina is no longer.
No longer, but he was, di ba? He was with DNR. But another side of the law will be the mental health law, no? So, but having said that, let's talk about this topic, mental health in the time of pandemic. But I invited Justin because he's an advocate of a purely science-based mental health treatment or therapy. So
What else is there? What else should there be?
So Justin, let's talk about you first. You graduated when?
So I graduated from the Ateneo College in 2009. Yeah, and then I took my medical training in UE, and I graduated there in 2014. Thereafter, I went to Makati Med for my internship, and then I took my residency training in psychiatry, which was actually. I was the chief resident in my final year.
Right.
Yeah. So right now I'm a mental health care provider for Mindcare Club, which is a telemental health company. So for the listeners in the audience who don't know what telemental health is, it's essentially what you get to do in the clinics, you now can do online. So via these conferencing apps, no. So I find that for most of the more common cases like anxiety, mood disorders like depression, even sometimes substance use, that sort of those sorts of disorders, telemental health is as efficacious as being there in person, But for other disorders that are maybe more emergent, in the sense that there is a risk of harm to self or others. Like if a patient is in an actively manic phase or in a floridly psychotic phase, telemental health isn't really the best option. And for that, I suggest that you bring those people into the ER.
The psychiatric ward still open. Nonetheless.
Oh yes, definitely. So in Makati Med, when the pandemic started, actually we started to know that the pandemic was getting really serious when even the psychiatry residents and the psychiatry staff in the basement, started contracting the infection. So, kasi geographically, the psych ward is in the basement, so it's separated from all the other. Yeah, it's isolated, and the fact that parang despite all of the precautions, it still happened. It still occurred in the basement.
There was infection in the psychiatry ward.
Sa mga doctors and staff. As far as I know, not the patients, because at first they limited the admissions to yung mga emergency cases talaga, and for the most part, if they had to admit, it would be up in the floors, the actual hospital rooms, no. Pero yun din, eventually I think around July, August, they started accepting na rin. So right now it's open. It's performing as usual, and then with all the necessary precautions. So there shouldn't be any hesitation. If anyone needs help, please come to our facilities. Yeah. Although I'm not affiliated now with Makati Med at the moment.
You're not. So in your, what is it called again, Justin? Telemind?
Telemental health.
Telemental
Yeah,
health.
right.
Because you're a psychiatrist, right? So which means
Yes.
that you prescribe. So what's your approach now? Has it changed or only the platform?
Well, it's essentially still the same. The principles are still the same. Of course, the principles in therapy, the genuine understanding, genuine empathy, accurate empathy. All of these are still the processes through which we do our therapies, no? Pero siguro the only thing that's changed really is where the cases might be stemming from for some individuals, no? So for definitely with the rise in the cases in the pandemic, I saw patients. I started seeing more patients, no, whose symptoms were a direct result of the environmental factors going on around them. So, and I'm not just talking about the fact that there's this disease that's going around and it's invisible and it's causing anxiety, whether you'll contract it, how hard it will hit you. It wasn't just that environmental factor. There was also the factor of this government's inept response, the president, yung mga sinasabi niya, yung mga...
Well, that's
so all of
affecting
those
people's emotion and mental health.
emotionally, in terms of mental health, I wouldn't even say na parang it's an indirect factor. Ngayon sa pandemic, this is where it came out, no?
And the situation would be like anxiety or depression or mood
anxiety, depression, and for the more severe cases, once you start letting the anxiety get the best of you, it can snowball from there. Suddenly, you start not eating right, nawawalan ka ng gana doing the things that you want to do. You don't sleep well anymore. And then with the sleep, biologically, that's for mood disorders, for psychotic disorders. That's our biological indicator coming mental health professionals. A patient could be well na, and then suddenly we see that the sleep's starting to get erratic and there's a pattern na. And then that's our red flag na, okay, maybe it's time for you to come in and we'll discuss, maybe we need to adjust your medications, maybe we need to process what you're going through. And so for these new cases, it started out as anxiety and then suddenly they couldn't sleep anymore. And I had one case, he was very well adjusted. In fact, parang he was an academic, intellectual, had high positions na, and for his entire life, walang problems. But then suddenly, the pandemic hit, and then he started not being able to sleep right. And then the reports came na at home, he was hyper irritable and also hyper vigilant, to the point na parang pati yung pagkausap niya sa family niya, parang na like he keeps pestering them na rin about like when you came in, you didn't wash your hands, you didn't change your footwear. So parang meron na talagang anxiety na repeating itself in his head. And then of course he at the time he didn't really realize that this was that this was a problem already. It was the people around him who were starting to point it out. And then, eventually,
let me get my most controversial question out first. No? So,
sure.
Our ongoing is being that a science approach to psychiatry, and because some people would give a spiritual approach.
I want to. I don't know if it'll settle that matter because, I'll get into it later. But essentially, what people have to understand about mental illness is that whenever mental health professionals tackle, the causes, the etiologies of any particular symptoms or conditions in any individual, no, we frame it, we see it through the lens of the biopsychosocial paradigm. So we frame it on those three parameters.
Biosocial
No?
paradigm.
Biopsychosocial.
Social
Okay,
paradigm.
so I'll get into it. So parang so let's see, we have a patient with schizophrenia, and in schizophrenia you have hallucinations, you have delusions, no, you have a lack of functionality. You start forgetting to groom yourself because of all the things going on in your head that are detached from reality. So that's schizophrenia. So a biopsychosocial approach would consider all the factors that led to the development of this illness and the maintenance of this illness, as well as informing the management that would need to be done. So, kunyari for schizophrenia, biologically, so that's the first, biopsychosocial, we discuss biology. So here we have the neurotransmitters, we have a discussion of the brain anatomy, and it's been shown that some brain areas in schizophrenia patients, are larger, and some are smaller because of the loss of neurons, or parang there's a greater volume of the ventricles nga, parang ganon. So parang we take that into consideration, also the genetic component of it. Where is where along the bloodline, who else had the same symptoms? And we find that for the most part, these mental disorders, like as in any medical disorder, talagang there is a huge genetic component, a genetic loading, right? And then for mood disorders, even if you had bipolar disorder, and then you had bipolar disorder in someone in your family, the genetic versus the environmental factors are responsible for around 75% parang ganon, of your own condition. Pag ganon, if you have a family history. So the biological component is very important. So again, to schizophrenia, the hallucinations, the delusions, they're there because of dopamine increases in some brain circuits and decreased in some brain circuits. So these areas all together, when you take the sum totality of their physiological activity, these are what give rise to the subjective symptoms na I'm seeing dead relatives, or I'm hearing voices in my head that are telling me to hurt myself. So yun. So even these subjective experiences, these subjective phenomena within the minds of the people, within the minds of the individuals, are rooted on biological activity. And I keep repeating this. Everything psychological is biological, because everything that happens in the mind happens only because of brain activity. And if there is no brain, there's no platform for the mind to do its thing. And whatever lofty, abstract ideas you get, art, love, gods, all of these things, these are all subjective and very humanistic and powerful phenomena. But these, again, the fantastic thing about it is it's rooted in the complexity of brain activity. Right. And we don't yet know, definitely we can't put a one-to-one, this neuron is causing this thought in this individual, leading him to believe in this or believe in that.
And let us just say that there is evidence for this, all right? This is not something
So yun. So despite, we don't know everything about it yet, but we know where the science and the evidence is leading us. And we're not free to come to our own conclusions and make up our own, we think of these things because of the mind and the soul and that sort of thing. I for one, don't believe in a dualistic representation of mind-body separation. No, I really, if you're a neuroscientist, any neuroscientist worth his salt would tell you that the reductionist view, that the mind is the brain, that is where the evidence points to. And fine, like if some people, if you feel like you feel better thinking that there's a soul or there's an afterlife or that
All right.
sort of thing,
So let's
that's
let's
fine.
ask the so that's basically where you look at the biology as well, and then the
Yeah.
approach will be biological.
Yes, but
Or-
also there's the psychological and the social component,
Yeah.
and that's what. And sige, sorry,
But we'll
Sir.
ask Doc Butch what he
Uh-uh.
thinks of that. So
Uh-uh.
the biology. So
Yeah.
do
Yeah.
you take that into account, Butch, when you diagnose, or do you?
Yes, yes. Actually, because we come from the same school, the best school in Santa Mesa,
In Aurora,
Aurora
Aurora Boulevard.
yes. I like to share.
I
with
thought you said that. You thought that in there.
No, medical school.
Yeah?
I'd like to share. I'd like to share with you a personal account. I went to Marawi 3 times. During the conflict, during the siege, together with the Philippine Coast Guard. And while I was there, I was fortunate enough to conduct a survey, a study on mental health of the Bakwits, of the internally displaced persons.
Yeah.
And what came out of that study? It's unpublished, by the way. No, so sayang, I still don't have time to. There's so much to publish. But what came about from the data was that the women had sila yung nakapag-adjust on an acute way. No, so within the first few months, it was the women who carried on the family. The men were depressed. The men had anxiety. No, they could not function. No, so yung mga nanay, sila yung nagdala ng pamilya. So they found ways to look for relatives. They found ways to look for places to stay, right? And after a few months, no, it was the men. No, yung mga babae naman ang nadidepress, yung mga lalaki naman ang mas active na, no, trying to look for a job, trying to find ways to So it's amazing how society, no, well, in for our Muslim brothers and sisters, no, how that dynamic, no, of family and society, and even with females and males, no, they have this dynamic na yung family, no, is the priority, no. Pero yung babae siguro mas resilient talaga. I don't know, Justin, kung talagang mas resilient sa umpisa, no, mas kaya nila. Well, in Marawi, that's what I observed, no. So with this pandemic, I don't know. We still have to make a study kung ano yung data regarding the demographic sa pandemic na to. But I'd just like to share with you, about how society, different societies, behave in certain crises.
Yeah. Actually, regarding that po, since you brought it up, no, the women initially they were more resilient. When it comes to resilience, kasi there are a lot of factors involved, and definitely, as with mental health, no, resilience, a very important component of well-being, of mental well-being for social animals like human beings, like Homo sapiens, is really community connectedness, and maybe that kind of the tendency for the females of the species to be more adapted to the social aspects of social life, of communicating. Parang this sort of served as a buffer, maybe being able to talk about feelings, being able to reach out and ask for help, being able to nurture another human being despite the crisis. These will all impact one's mental health positively. And I'm not being stereotypical here, or chauvinistic, na parang like tipong because women are built for this and men aren't. No, but this has correlates in what I say. The brain, the biology of women is that, like, it's been shown that women have thicker corpus callosi. This is the connection, the bundle of fibers between the both hemispheres of the brain, and women as well as homosexual men. And parang the thing with that is it means there's better communication between the hemispheres because there are more bundle fibers. Therefore, the functions of the higher cortices, which are communicating, which are seeing seeing other people, personality, which is observed by the frontal lobes, no? All of these kind of are a bit more optimized, therefore, in women. So I mean, of course, like we can't say it applies for everyone, no? Pero like siguro if you were to take a population, it would be fair to say that a majority, a substantial number of that population would fall under these characteristics, no? So definitely, I you know, I'm not trying to be I'm not trying to paint everyone with one broad sweep, no? So, but that is what I am. I like to advocate that even these very human characteristics of social interaction, these very subjective experiences of sharing feelings, experiencing feelings, empathizing with another, these all have correlates in the brain and in brain activity. And without this organ, no, you wouldn't have anything at all. There would not be personality, and there would not be a continuation of personality after the brain stops operating. So that's my perspective on this. But definitely also, yun na nga, as I was saying, it's biopsychosocial. Whenever there's a mental condition that we try to assess, we also take the psychological factors into account and the socio-environmental. So for psychological, let's say someone has automatic patterns of thinking that they adopted when they were kids and they brought into adulthood. Automatic patterns of thinking or cognitive distortions could be like catastrophizing. Like parang may mangyari lang na mali, already their minds go straight to the worst case scenario. This of course gives rise to anxiety or depressive symptoms, no? So those are the psychological components of mental illness.
What do you, well, let's, of course, we're generalizing. No? Government, we really cannot control how the government is responding to the pandemic. Do you tell them, oh, just don't watch the news or stuff like that?
You know, there is a disparity between my functions in the clinic when I'm talking to an individual, and my goal is for them to find wellness, get better, optimize coping. And there is a difference in my functions when I'm a speaker, when I advocate for the things that are important to me. So for instance, it's true, like in the clinic, you can't tell them like, to change politics, to change the way the government is running things. What you can do there is kind of optimize their coping mechanisms, how they absorb the information, how they process it in their heads, and what they do with that.
What would be the like your top 3 advice that you tell them? Optimize the coping.
Well, it's broad. Okay? So maybe, let's say for someone who was distraught about how the government is handling it, and parang because of their specific way of thinking, they feel like they're going to be affected by the bad decisions of the government, not specifically their family. Ganyan. So pag ganyan, what my approach is not to be my approach isn't so much positive thinking. That's not what therapy is about. Therapy is about realistic thinking. So kunyari, we process it. I ask them, what does this mean for you if the government is like this and it does this? And then they talk about personal things in their own family lives maybe. And then they say, I have a grandmother here who I'm afraid will contract the disease because the government did not allow lockdowns and she's still going to the market. Ganyan. So it's a very case-by-case basis. So I'll tell them, first and foremost, I'll give them the information na who gets infected, what's the rate of infection, what's the probability maybe. And then from there, I talk about, healthy strategies that have been proven to prevent infection. And then I ask them, like, parang, do you think you can do these strategies? What's keeping you? Or parang, what's a hurdle that you can anticipate in carrying out these strategies that might make the optimal ideal outcomes difficult, and then we try to get around that. So it's a very case by case thing, and there's again with what I like about psychiatry dealing with something so subjective. It really gets to the individuality of people, you know. It gets into the core of the human being there in front of you.
It also, like, that will be a difference if they consult you than for somebody, like a guidance counselor, because you know the medical side, so you know that this is what's going to help you not get infected, right?
Well, that is one, that is one aspect of it, I think, but not to not to diminish the
Value.
the value of guidance counselors and even psychologists, because honestly, like these guidance counselor psychologists, they're excellent at their specialties. In fact, like parang I would argue na if what you need is talk therapy, psychotherapy, and you don't really need medications for the biological symptoms like sleep or maybe severe depression. Talk therapy would best.
So because that's very important now. So while you say, you guide them through the science of it, the medication, this is what's proven to have prevented infection. You tell them that. But if somebody's already lacking sleep, you will not necessarily prescribe ano na ba pinaiinom ngayon? Valium?
Iba-iba, no? And there are a lot of better options. There are a lot of better options naman. Pero,
but
that's
so
the
you
thing.
Would say talking it out is still your is that what you still tell them?
Like we have a reputation, psychiatrists, of being pill pushers. But honestly, the prevailing practice ngayon is, even in psychiatry, as if the patient doesn't need medications, don't give medications. If the patient can get by with psychotherapy, which is talk therapy, or other more like talk therapy, cognitive behavioral therapy, interpersonal therapy, all of these sorts of processing.
So just
then go for that first.
Like having a difficulty sleeping, no? So what will be your like first aid na pwedeng sabihin sa kanya?
Okay, so first of all, let's make sure that your sleep practices are correct. Baka naman like you're using gadgets even up to the time you're sleeping. Baka naman like parang your environment is not conducive to sleep. So what we call sleep hygiene is very important. So I say no gadgets 1 hour before bedtime. The TV shouldn't be on even in the background. Lights should be completely off. Okay. Also, para lower your body temperature. So take a shower, take a bath before bedtime. Make sure that you reserve the bedroom only for sleep and sex. And then so that the associations aren't when I'm asleep, like I'm thinking about work pa rin. So none of that. And if you can't fall asleep, get out of bed. Because one of the reasons for insomnia talaga is not so much you can't sleep, but you're worried about what it means that you won't be able to sleep tonight, and you're worried that tomorrow I'll be so stressed at work and I'll be groggy. Yung mga ganyan. So if you can't sleep, get out of bed and then try again after 30 minutes. So these are all sleep hygiene practices that we recommend first. And this, if kunyari the patient tells us despite doing that, it's still not working for them, or we see na talaga na it's affecting their functionality, then that's when we prescribe medications, because sleep is a biological phenomenon. No, so and that's and it also depends. The medications will depend on like what sort of insomnia they're experiencing, like when do they wake up, how long are they asleep typically, yung mga ganyan. So there's a lot of factors involved.
So parang yun yung biological aspect. So you try to see whether there's hygiene or what do you call it?
Sleep hygiene. Yes.
So if it's conducive to sleeping na yung kanyang
environment. And actually that's hindi uso dito ang home visits, pero I've done a few, and I find na parang that's the best day. You get to see like how the individual is living within their own circumstances and in their own abode, and you see what the setup is. Oo.
as you know, that our students, they also study at home and probably in their own bedroom.
Oh,
Paano
yeah.
yan? What would be the are you seeing more students? Are you seeing more students
There is
than than before? Because I know that you already did.
well, kasi ako, that's not my subspecialty. I'm not a child and
Alright.
adolescent. But
Yes,
I have
okay.
had, kunyari, I have had college na. Yung tipong hindi na less than 20, no, less than 80. So parang college students na sa thesis, doon nagkakaproblema. But not yet talaga because of COVID itself. But I don't know. I can't answer that because that's not my subspec talaga. So I don't attract
But
those sorts
not
of populations.
necessarily the online classes have caused a lot of mental, at least from
Ah,
your end.
well, there have been accounts na rin naman na parang, the problem with these online classes, even online work, no, there is no distinction anymore. The boundaries aren't clearly drawn. So, parang what I recommend for those individuals talaga is you have to stick to a routine. You have to set boundaries for when you're going to work, when you're going to answer emails, when you're going to accept questions from your employees or your bosses. And then stick to it strictly. Because even like, kunyari, even yung mga bosses, like my brother was telling me, he works at a bank. And talagang, because of this pandemic, it wasn't easier for them even if they work from home. Because like even their bosses think that everyone's working from home anyway, I can message anytime. Ganyan. So parang there are no boundaries there. But you have to maintain boundaries for your own sanity, you know? And then so there, maintain strict boundaries and try to find safe spaces within your own home. In fact, not find them, build them yourself. So like if you're going to work, don't do it in your safe space. Like if you identify your safe space as your bedroom, then go outside, spare yourself. Yun. So there.
Let me ask Doc Butch. So Doc Butch, this merging of boundaries, Ben, they're causing a lot of mental health issues.
Yes.
Do you
Yes.
think at some point we will really go back to work, or because mental health is not just secondary, it is primary.
Recently, in response to actually mental health, issues with doing remote learning, the university, the UP released a memo that we will be on a 1 week academic break on the first week of November. So there will be no classes, no asynchronous, no synchronous classes. We are not to tell.
Talagang break.
Wala talaga.
Yeah.
So
we will have that. No? We'll have a quarterly break.
yeah. So for 1 week, and that's a welcome. Actually, it's a very very welcome move. Also for professors like me, Kasi it's also hard, for example, in my STS classes, nakikita ko yung difference between remote learning and what we're having now, and what we had before, Nakikita ko yung mga mukha ng mga estudyante ko when I teach. I get instant feedback, whether they understand me or not. In this case, no. And whenever I give asynchronous activities like viewing a documentary or reading an article, I don't get to see them, and they don't ask questions, which leads me to believe that maybe they're doing it at their own pace, or maybe they don't understand it. I really don't know. That puts a lot of stress also on the professors. And yesterday, I had my synchronous classes, but I devoted it to parang kamustahan sa mga estudyante ko. So
you're versed with that naman, di ba?
yeah, parang I only had about 15 minutes of meeting time with them, or 20 minutes, and nagkamustahan lang kami, And nung sinabi ko yon, I see their faces. I asked them to turn on the video, I see their faces light up bigla. Biglang ngumiti sila, parang woo! Parang buti na lang walang class ngayon. So nakikita ko first hand talaga na nasi-stress na yung mga estudyante ko, Sa Zoom meeting pa lang, it seems.
So do you think we'll eventually go back to school? para
We will,
magkaroon
of course, we will, no. Pero
Right.
siguro sa second semester we'll have some sort of blended learning. Ben will have, he has a good idea on how to run it, no. Parang blended. No? I think Ben is the better person. He's been thinking about it ever since he was nung ano pa siya, nung chair pa siya ng STS department namin about yung blended learning.
Oh, Dr. Vallejo.
Oh,
So it seems that mental health dictates
yeah.
that we go back to the campus.
No, yun nga, because we remember that learning is a community effort, no? So putting people in Zoom doesn't really fulfill yung community dimension. Also, talking about mental health, no, in previous incarnation, in quotation marks, I was trained as a counselor when I was in a residential college during my PhD.
My
No?
gosh, you learn something new about Dr. Vallejo every day.
So I can relate to the discussion
Dr. Aquino.
on mental health. No? Ngayon, the thing is, ngayon, graduate students ngayon are having difficult time because they can't do their research.
Even more.
Yeah.
Kasi nga, they cannot
Remember, their
believe
community is their lab
the library.
until they get their PhDs. The science
Okay.
research. Okay, then it's becoming an issue now. The reason why UP actually put on a break, they did a survey talaga of students. So may data sila, and I hope the psychologists would be able to look into it. May mga tinanong talaga eh. I am not privy to it kasi hindi ako student. So, but they did ask certain questions. It was and will we go back to the I think we can't go back to the old there will be probably some face-to-face classes, but it will be limited. Okay? And students will probably be more yung self-directed through modules, yung kanilang learning. Okay? But I think for the college level, nakaka-adapt naman sila. I'm trying to find out from my colleagues who are teaching in basic education, what is the score about remote learning, no? I just heard from a parent na yung maliliit na bata, maiksi yung attention span sa online class, and that's leading to some learning and psychological problems, no? I heard from a parent na bigla na lang umalis yung bata doon sa screen sa laptop, okay? Sabi ko, and how old? Tanong ko nga, ilang taon na ba yung anak ninyo? The child is only about 6, grade 1, di ba? Sabi ko, of course, in some children at that age are still watching Blippi. Di ba? So yung attention span nga nila, I think that's a big challenge, no? Yung ate ko is professional elementary school teacher pero nag-retire na siya. Tinatanong ko nga paano nagko-cope up yung mga kasamahan niyang teacher doon sa school. Okay, my sister is now retired, so she missed out on the excitement of COVID, no? COVID teaching in COVID time. Yun nga, I think ang sabi niya sa akin, the teachers are telling her na the students there's something happening on the other end to students, no?
All right. So yes, go ahead. Because we're running out of time.
The teachers are not trained to handle that, di ba?
So that's what I was going to ask Justin. When somebody is, since you're not going to give them advice to Jesus to Calvary, what is your advice when a student or not a professional is encountering difficulty? What is your advice?
Difficulty
and then that will be the last because we ran out of time. Yeah, if somebody is having difficulty like with a school or work, what's your
It's a very broad question kasi like difficult.
Kung kumbaga nahihirapan sila in Filipino. Sa atin, most likely, batahin mo. That's what.
There's no one piece of advice I think that I could give everyone in the diversity of the problems that they would encounter. Pero I think that for these unprecedented circumstances that we're all finding ourselves in, it's important to practice radical self-acceptance. Okay, that's an acknowledgement of your own capacities in this pandemic, and that you don't have to always be operating at your 100%. This is not a normal situation for any of us. You don't have to be normal either. Okay, so practice, like if
like
you can
that.
allow yourself, if you can allow yourself to operate at 60% efficacy, no one's gonna blame you if you know this is what you're going through right now. We're all going through it. To practice radical self-acceptance and extend this to your concepts of what other people are going through as well.
All right. So compassion.
Yeah.
Be more mindful of what others are going through as well.
Right.
So Justin, apparently we have barely scratched the surface on mental health and the pandemic and mental health, no? And I like that radical self-acceptance, and instead of this culture that's also been brewing this, I have to be my
Positive
100%.
thinking,
Yeah.
optimism. No,
Yeah.
I'm totally against that.
Yes, indeed.
Yeah, it's about thinking realistically.
Realistic. All right. So, but also to take care of one's physical health. These are parang vice versa yan. They work on each other. Mental health and physical health.
Well, of course, everything psychological is biological. So, exercise has been proven for mild to moderate depression. Eating well, sleeping well.
Yes. So you have your work cut out for you, Justin, and nice seeing you. Maybe,
thank you for having me.
Are you in CBD? Is the clinic in CBD? All right.
No, so I'm holding clinics from my condo. So
it's near the hospital still, because
still
your significant other is
she's still working at the ER, so her work is harder than mine.
All right. All right, that's good to hear. All right. Okay. See you, Justin. Thanks.
All right. Thank you for having me, doctors, Doc Butch and Doc Ben and Sir Joby.
All right. So I'll see you, Butch, and Ben. We don't have time anymore. So see you next week, and thanks.
Okay.
All right.
Bye.
Bye, everyone.